In recent years, several countries have grappled with the ethical dilemma of legalizing euthanasia, a practice that remains forbidden in the Philippines. The Philippines, like other nations, stands firm in prohibiting euthanasia, as this act can potentially lead to charges of murder. Euthanasia is referred to as mercy killing, involving the act of administering lethal medication to a patient experiencing incurable diseases, specifically at the direct request of the said patient. In this discourse, we argue that euthanasia should be legalized as it holds the fundamental right of the autonomy for patients, especially when confronted with challenges of terminal illness. Many in the medical field have argued that practicing euthanasia would cause a slippery slope. According to Kono and others, allowing euthanasia should lead to many things where euthanasia is practiced in cases where it isn't allowed. However, by implementing legal countermeasures, a slippery slope can be prevented, limiting euthanasia to its main purpose. To add more information, countries such as the Netherlands demonstrate that implementing these countermeasures does not necessarily lead to a slippery slope, where euthanasia is done in cases where it is not permitted.
Euthanasia emerges as a compassionate option for individuals suffering from unbearable pain due to terminal illness where the hope for recovery is non existent. Amidst these challenging circumstances, individuals frequently find themselves unable to continue with their everyday lives. A study by Verhofstadt and others in 2021 stated that euthanasia is performed among adults across various age groups who struggle with chronic psychiatric disorder. The primary reason behind this request revolves around existential suffering and a perceived absence of prospects for improvement. Furthermore, a study by Abakari in 2021 revealed that euthanasia has the potential to alleviate the patient's suffering. Additionally, Brinkman, Stoppelenberg, and others in 2020 stated that euthanasia shall only be allowed upon fulfilling a specific criteria. Firstly, it must be voluntary and must stem from the patient's request. Secondly, the patient must be enduring unbearable pain with no hope for recovery. Thirdly, the patient must be informed about their situation. Fourthly, no reasonable alternative should exist that would alleviate the patient's suffering. Fifthly, the involvement of at least one independent physician is mandatory, along with a written statement containing the professional judgment. Lastly, the practice of euthanasia must adhere to meticulous medical care. In conclusion, supporting euthanasia for individuals suffering from incurable illnesses reflects a compassionate understanding of their intricate situation. It emphasizes the significance of recognizing the choices of those in dire circumstances, particularly when traditional treatment provide limited hope for recovery.
Lastly, this respects the patient's right. Abakari states that since it is the patient's own life, they have the right to choose to end it willingly. Therefore, the patients decide on what to do. The choice of whether to live or die belongs to the patients alone. Should the patients make the decision, it will represent their independent judgment and personal worth. The patient's autonomy and dignity will be ultimately determined by their free will. In addition, people who are used to choosing their own medical care throughout their whole lives ought to be able to do it the same when it comes to how they pass away. Moreover, according to Brinkman, Stoppelenberg et al., the people and physicians from the Netherlands generally agrees that every person should have the right to euthanasia due to the fact that patients should not suffer from unbearable and hopeless suffering that they endure. To sum up everything that has been stated so far, euthanasia's objective is to honor the patient's right. Patients have the freedom to choose whatever they want to do with their own life, including their eventual death, demonstrating their independence, dignity, and autonomy. In conclusion, the arguments presented strongly advocate for the legalization of euthanasia, highlighting its importance as a considered and dignified option for individuals suffering from terminal illness. The vulnerable should be granted the choice to be eased from their suffering. However, acknowledging the potential for abuse in euthanasia is crucial. Supporting euthanasia makes a pathway for individuals to be given the right to make decisions in terms of how they should depart from their time on earth. That is all for our speech about euthanasia. Thank you.
Additionally, it ensures that people should pass away in a dignified and peaceful manner. According to Sprong and others 2018, providing people with a dignified and peaceful death is made possible by euthanasia. It supports one's right to autonomy by letting them choose the kind of mortality care they want. Euthanasia can be an appropriate and humane alternative for people who are suffering from a terminal disease or other terminal illnesses, since it relieves their pain and gives them the freedom to pass away with dignity. Euthanasia judgments must take individual circumstances, preferences, and values in careful consideration. Strict protections and regulations are also essential to guarantee that euthanasia carried responsibly and morally. Euthanasia is a growing trend among doctors and the general public as a way to provide people with severe dementia with a dignified and peaceful death if they are in excruciating pain. Although there are worries about possible misconduct, people think that having precautions can lessen the risk. Individuals that choose euthanasia could sense more control of their death. The benefits of euthanasia in lessening the suffering of those with severe dementia are widely acknowledged by the healthcare community and the general public. In the end, euthanasia can offer an appropriate end-of-life decision that puts dignity and peace first when controlled. Brinkman, Stapellenberg, and others 2020. In conclusion, euthanasia offers a peaceful, dignified death, particularly in terminal disease cases, preserving autonomy. Despite reservations, it's increasingly popular as a humane, controlled decision, prioritizing individual needs and achieving a dignified, peaceful death.